And good afternoon, everybody. We're so happy to have you join us for our panel discussion on a topic that we feel is so very important to both the healthcare and fitness industries, in addition to the overall health and well-being of our population. That is merging healthcare and fitness, the new pathway to growth. We have a fantastic panel today, and I'd like to take this time to introduce each of them to you. Dr. Bob Salas is a family medicine physician at Kaiser Permanente in Fontana, California. He is also the director of their sports medicine fellowship and on the administrative faculty for the family medicine residency program. Dr. Salas is an international advocate for exercise as medicine, which he founded in 2007 when he served as the president of the American College Board for the Exercise as Medicine Global Health Initiative. Dr. Salas earned his Bachelor of Science degree from the United States Air Force Academy and his medical degree from Texas A&M. Karen Wonders is the founder and CEO of Maple Tree Cancer Alliance and professor and program director of exercise physiology at Wright State University. Her passion is to advocate for exercise as part of the national standard of care for cancer. Through her nonprofit organization, Maple Tree provides free exercise training to thousands of cancer survivors every month at 55 clinical locations across the United States. She also has offices internationally in Brazil, China, New Zealand, and Mexico. Dr. Wonders is committed to evidence-based practice in her facilities and has a robust research program that has published 2 textbooks, 4 book chapters, and more than 70 peer-reviewed manuscripts on the topic of exercise and cancer recovery. Mike Feidelberg is the president and chief executive of the EDGE organization of Vermont. The EDGE is a network of facilities that includes 4 large multi-use health clubs, 2 accredited preschools, 3 physical therapy clinics, and 2 preventative care clinics. Mike has a particular passion and insight for corporate wellness and forming alliances with the medical community and insurance providers. Mike has served on the board of the New England Health, Racquet, and Sports Association and is the current vice president of the Ronald McDonald Charities of Burlington, Vermont. And Dr. Amy Bantham is the founder and CEO of Move to Live More, with a mission to help people live healthier, longer, and more active lives. A research and consulting firm addressing physical inactivity, obesity, and chronic disease through cross-sector collaboration and innovation, Move to Live More provides services to clients in 3 sectors: healthcare, health and fitness, and communities. Amy is the president-elect of the Physical Activity Alliance. She holds a Doctor of Public Health from the Harvard T.H. Chang School of Public Health. Welcome to our panelists. This is going to be an interactive discussion, and we want each of you to join in by using the chat box to write any questions and comments you have. If your question is directed to a specific panelist, please note that. Otherwise, we'll open it up to all of them. So I'd like to begin our discussion now with our first question that I would like to address to Dr. Bob Salas. Bob, you've been the leading advocate to merge healthcare and fitness since you started the global initiative of exercise as medicine while serving as the president of the American College of Sports Medicine back in 2007. Please tell us what merging healthcare and fitness means to you. Where did it come from, and is it feasible?
Yeah, thanks, Mike. You know, I've been a family medicine physician going on over 30 years now. And I tell you, it wasn't long into my career that I began to realize, my gosh, most of the stuff we do does not have that much of an impact. From all the pills and procedures, my God, we're almost bankrupting the world with healthcare costs. I feel like it's always over promising and under delivering with healthcare. And at the same time, I began to clearly observe that patients who came into my office who were doing regular physical activity, particularly elderly patients, had just dramatically better outcomes. And then through my involvement with the American College of Sports Medicine, I got involved and met a lot of the researchers who had really so clearly documented the health benefits of physical activity. And it really occurred to me, why would we not be leveraging this in healthcare? And so I convinced early on our leadership at Kaiser to begin using an exercise vital sign. And I have found that my patients who I can get to be more active, the effects are just dramatic. And everything from their mental health to their cardiovascular health, to their flexibility and the ability to do the things that they want to do, the activities of daily living, it has dramatic effect. And I'm just convinced that we could do more for the health of America by promoting physical activity than such an emphasis on pills and procedures. And we could do it at a much cheaper cost. So yes, I think it's possible, it's feasible to do this. And I think we have a group here that I love to hear the ideas on how we could make that better happen.
Thanks, Bob. I'd like to address my next question to Karen Wonders, please.
Hey, Mike.
Next slide, please. So
Actually, Amy.
Next is Amy. Yeah.
Amy.
Oh, I'm sorry, to Amy then. So Amy, tell us what you think have been the barriers to the health and fitness industry supporting exercise medicine. And in your opinion, is that changing today?
Thanks for the question, Mike. Very short answer to answer your question. I think there are three main barriers to the health and fitness industry integrating with healthcare. And short answer, I do think that's changing. So what are these three barriers that I've seen? The first is that really it comes down to what has historically and traditionally been seen as success in the health and fitness industry. It was really founded to help fit people get even fitter. And it wasn't founded thinking about how to best serve the needs of people with chronic conditions. I think that's really changing now in a very disrupted health and fitness industry and it's very much driven by consumer demand. Consumers looking for inclusive environments, programming, and services, and they want health and fitness facilities that can provide those. So that's the first barrier. Really, the second barrier is that for health and fitness clubs thinking about being in this space, it's really very daunting to get started. And so I actually have put together a roadmap for health and fitness centers seeking to get started based on my research. And it really spells out, you need to start with evidence-based programming and services. You need to promote those programming and services to members and potential members. You need to measure the impact of your programming on health outcomes and communicate those health outcomes to healthcare providers. What's the third barrier? It really comes down to building trust and relationships, and it takes a lot of time to build trust and relationships with healthcare. I really found in my studies and research that there is a trust gap. And what I mean by this is healthcare providers are much more comfortable referring to medical fitness than they are to commercial fitness. I found that over half of physicians would refer to medical fitness, but only about a quarter would refer to commercial fitness. So overcoming that trust gap, if you're a commercial health and fitness operator, it really takes time, it takes relationships, it takes measurement, it takes communication of health outcomes, but it can be done.
Great. Do any of our other panels have anything to add to that? If not,
I mean, as Mike, as the health club person here sitting here, I can't agree with Amy more. That was one of the biggest challenges when we first got started, was spending time with physicians and trying to incorporate them into what we were doing. And it did take a long time. It did take bringing that trust, and certainly again, exactly what Amy said, having evidence-based provable outcomes. And I think that was the big difference where we kind of were able to bridge that gap, was to be able to provide them with the necessary data to show them that our standards were there, our practices were there, and we were providing the kind of outcomes that were reliable and they could trust. We spent a lot of time cultivating those relationships, spending a lot of time inviting them in, not just the docs, but their staff, so they could experience what we were doing and how we were doing it. But that was a fundamental step in doing it.
Great input, Mike. Thank you.
And I really appreciate Amy's barriers there. And I would add that my patients, I think the health club can be an intimidating place for somebody with type 2 diabetes. You know, most of them don't look great in spandex, let's face it. And coming to a health club can be kind of intimidating for them.
So Karen, can you tell us a little bit about Maple Tree Cancer Alliance and how you started it?
Sure. Thanks, Mike. So Maple Tree Cancer Alliance is a nonprofit organization that I started back in 2011. And basically what we do is we provide individualized, supervised exercise to patients as they're going through cancer treatment. And really it takes place at any point during their cancer treatment trajectory. So it can be anywhere from the time of diagnosis all the way through survivorship. Sometimes we'll have patients who are like 20 years out of cancer treatment and they'll want to come and exercise at Maple Tree. Basically, I started Maple Tree out of the work I had done in my doctoral program. So in 2003, I started my doctoral program at the University of Northern Colorado and had the opportunity to study under Dr. Carol Schneider, who is one of the founding researchers in the field of exercise oncology. And, you know, at the time I was very young. I really didn't know very much about cancer, but I was conducting this research and saw the benefits that individuals had when they were going through treatment. I didn't realize at the time that this was not already standard of care. So before my doctoral work, I had done work in cardiac rehab, which is standard of care for cardiac patients. And I, wrongly assumed that it was the same way for cancer. And so when I graduated and moved to Ohio and started working as a professor, a year later, my grandfather was diagnosed with colon cancer and was told not to exercise by his oncologist. And even when I pushed, his oncologist did not know the research, didn't know the benefits. And ultimately, that's what led me to start Maple Tree, was to try to change that narrative and educate not only oncologists, but patients and caregivers about the benefits that exercise can bring to someone who's battling cancer.
And I think you've done studies in over 11,000 people with cancer using exercise and been able to show fantastic results from that.
Yes, absolutely.
So thank you. Anybody have anything else to add to that on the panel? If not, I'd like to address a question to Mike Feidelberg. And that is, I'd like you to tell us how you're using exercise to treat people with chronic disease currently, Mike.
Yeah, thanks, Mike. I think it's really what everyone said so far. It's kind of a collection of what we were just talking about. We all know the figures in terms of the population of 20% of our population is familiar with what we do. 80% really is not. And how is our clubs going to reach that 80%? A lot of them really needing our help, not just wanting our help, or those fitness people looking for a place to go, but folks that really need us the most. And these are oftentimes people with chronic disease or borderline. So we try to do something in which we are strengthening people both physically and mentally. A lot of times it comes out of our lifestyle programming. That we're able to work with people that wouldn't typically come to the club with an idea of creating a supportive environment, an inspiring environment in which they're working with folks that are on their level in an environment that they feel the most comfortable, and then try to expose them to as many different facets of the club and exercise, whether it's a yoga class, whether it's pickleball, whether it's Group X, doing something in which they find. And we find that doing this brings them into the club setting, brings them into the environment in such a way that they feel good about the process. And most times, I would say around 80% of the folks that have never been in the club participate through one of our programs or are here because of a chronic illness, tend to stay beyond the program. We average around 80% in total will stay on beyond the program, and really at that point come in as a traditional member, and that's what we love, because we really know that person has created a habit that's healthy and positive, and they're going to see the lasting results as a result.
You know, you mentioned something that I think is so critical, and I know that the other panelists, I've had this discussion with them as well many times, and that is the fact that the socialization piece is so important. And you know, I have so much respect for the programs you've run at your facilities. So I really think that's part of it, getting them out of that sick care environment, getting them into a more electric and social environment certainly helps quite a bit. And if anyone on the panel would like to add to that, please feel free to do so at this time.
Yeah, great comments from both you guys. You know, as a family medicine physician, let's face it, my patients who belong to a health club, for the most part, I'm not worried about them. I'm more worried about the ones that never have belonged. Feel if there was an easy entree, it could be tremendously beneficial.
Yeah.
Great.
So Mike, before you go to the next section, I want to read out a comment that has been shared by Cosmo Wallen.
Okay.
So the comment is, it's a very nice, pertinent comment. I have been consulting in this space for 20 years. And I believe the greatest barrier is that the medical world and commercial world speak a different language. And while I agree with Dr. Amy that trust is necessary, it is often challenging to trust someone you cannot fully understand. We all need to work harder to bridge the communication gap before we can address the trust gap.
Right.
Yeah, I can speak to that. I
Yes.
think that communication is absolutely critical. I agree. And in the 10-step roadmap that I put forth for health and fitness operators, I would say the majority using education and awareness, communication, to Cosmo's point, to collaboration, and the end goal is trust and filling in that trust gap, and communication is the tool by which to do that, or one of the tools.
Yeah, Mike, one of the things that we found really helpful is we try to share as much data back to the physicians after someone's participated in a program. And we were finding that connection between the physician, either our health coaches, our personal trainers, or registered dietitians, that kind of linking everybody in together has made a big difference. And again, to Amy's point, we need to raise standards. The industry, I think, needs to have standards. And I do think that there is a language that our industry needs to work up to have those relationships with the medical community be as seamless as possible and work within those systems for maximum result. There's no question.
Agreed.
Amy, there's a follow-up question for you. How can we get that 10-step roadmap Kim Pauline has asked?
Oh, sure. It's at movetolivemore.com, and I can also make it available.
Okay. If we can share the link, we can also make an effort to share the link. Okay. And there's another question from Monica Fogel. I wonder if many healthcare providers are concerned about, one second, what's this?
Are you able to read that?
Yeah. I wonder if many healthcare providers are concerned about recommending PA programs because of costs. How can we gain more coverage of evidence-based programming through medical insurance, Medicaid, and Medicare?
Yeah, I can certainly address that. I do think cost is an issue, and that and just sort of the unknown. Most physicians aren't really familiar with what a health club could offer, the types of programs that are there. And I think the more that those are tailored and made at a reasonable cost, and we show benefit, then we could begin to think about reimbursement and asking for reimbursement. I think it's tough to lead with. We need to get paid for it. I know that's a tough conundrum. But yeah, and I think it's just that communication back and forth is really lacking.
What do you
If-
think? Go ahead.
I'm sorry. I was just going to jump in and piggyback off of what Dr. Salas said, because at Maple Tree, all of our clinical exercise programs are offered for free to the patient. And so we have to work with the healthcare providers to get our services paid for, because, as said in the question, it's not yet covered under insurance. So a lot of the research that we have done is centered around the ROI back to the hospital. And so, we've been able to demonstrate reductions in healthcare utilization, which then saves the hospital system money on the back end for providing these services. And I think that they'll continue to see that when they partner with health clubs as well, because if I'm looking at cancer and if we have the active treatment phase done in a clinical setting and then transition the patients to a health club for when they're finished with their active treatment, then that healthcare center, the cancer center will get to see those long-term benefits and those long-term ROI, even when that patient continues to exercise and they're not currently in active treatment. So that's something we've been working to try to show and demonstrate back as a way to get them to hopefully pay for some of the services.
Yeah, that's great, Karen. And I've certainly seen that data on the tremendous ROI. And it's just astounding to me that what is the ROI from chemotherapy? Most of it makes the patient sicker. It ends up costing healthcare systems dramatically more. But at the end of the day, we're hopefully lengthening life and improving quality of life. And so it's amazing that they sort of hold chemotherapy to a different standard that they would hold exercise prescription and treatment.
Yeah,
Absolutely.
There's an interesting suggestion offered by Bob Squire. Many of the initial payments can be made through company HSA accounts that can be applied to health club programs.
And that's interesting because in many cases, it's the employer that actually pays for the health insurance. And it's in the employer's best interest to keep that top 20% of the high claimants healthier, and everyone for that matter. I wanted to ask particularly the panel what they think of possibly approaching insurance providers and healthcare providers with offering a rider to their insurance, very similar to what Aflac does. Anybody have any comment on that? And what I mean by that is if an employer is covered by any healthcare plan and that healthcare plan offered a $19 rider for anyone that included exercise prescription programs with chronic disease, everybody pays for it, but only a very small percentage use it. Would something like that be considered?
Yeah, I think that seems like a logical way to go, Mike, and really pushing the purchasers of the healthcare that represent employees of a company, that they ought to be banding together to say, we want this kind of thing in the event we got really sick.
Yeah. Okay, thanks so much. The next two questions I want to address to the attendees, to the audience, and let's pull the first one up. Do you believe your club should serve all populations, including chronically ill patients? If you can just answer yes or no quickly on that, and we'll take a tally.
This is a poll question for all the participants. the panelists cannot answer this.
Yeah, so we've got about 31 answers, and about 90% say yes. There's about 10% who say no to that. But yeah, those are the answers. So most of you definitely believe that to be true.
Great, and let's go to the second question. You want to bring up the second question, please?
Yeah, I'll bring it up here.
Do you agree that exercise is a powerful medicine that should be used as a standard of care for people with chronic illness? Again, if you can just check the box, yes or no, and we'll take a tally and then we'll move on.
So yeah, we've got about 100% saying yes to that, for sure.
Great. Okay, let's move on to our next round of questions for our panelists, if we can. And again, I want to address this first to you, Bob. As a physician, how do you assess your patient's physical activity level and then prescribe exercise when it's needed?
Well, Mike, my practice has my entire career been at Kaiser Permanente, and about 12 years ago, as I mentioned, I convinced our leadership to use what we call an exercise vital sign. So that it's essentially asked by my medical assistant of every patient at every encounter. They ask two questions. The first is, on average, how many days each week do you do moderate to vigorous physical activity, like a brisk walk? And the medical assistant clicks 0 through 7. And then the follow-on question is, on those days, on average, how many minutes do you exercise at this level? And they click 10, 20, 30, 40, so on, corresponding to the patient's answers. So when I come in the room, along with blood pressure, pulse, their weight, and then also including their BMI, whether or not they smoke, I'm provided with the results of those two questions. And obviously I'm looking for 150 minutes a week, and being consistent with the US physical activity guidelines. And so if the patient is doing that, I usually, my first thing is to congratulate. Good job. You're meeting the exercise guidelines. And if it's less than 150, typically I begin with, hey, I noticed today your blood pressure is high. And I also noticed your exercise vital sign, you're only doing 100 minutes a week or less. Why don't we start with the walking program? And typically I'll tear off a walking prescription that just reminds the patient to walk 30 minutes, 5 days a week. And I'll tell them to use the sing talk test, walk at an intensity high enough that you couldn't sing, but not so intensely you couldn't talk, which sort of puts them at that moderate pace. And that's typically my approach. Now, from years of doing that, I realized I need more than that, because so many patients, number one, they just don't do it, or they need something more specialized. They need resistance training. They need flexibility training. I'm concerned about them falling and breaking a bone. Their DEXA scan shows their bone density is in the osteoporotic level. They will benefit from a resistance training program. I have no way to do that from my office. And really, to me, pretty clearly, I need a fitness professional. I need to be able to refer to a fitness professional who can help them. And it's frustrating to me that that's not covered. I can refer my overweight patient to a bariatric surgeon, and we pay for that, but I can't get it reimbursed to have a fitness professional work with them, and somebody that really can get in and hammer out a good nutrition plan for them combined with exercise. I need that. And it makes no sense that that's not available, because if you look at the guidelines for any chronic disease, the first line of the guidelines says exercise, whether you're talking about diabetes, cardiovascular disease, depression, dementia, on and on and on. It all starts with exercise, but most all physicians skip right over that first line to the first medication and write a prescription for that. And I tell you, it's been one of the most frustrating parts of my career. Why can't we change that? It makes no sense.
Yeah. Agreed. Next question I'd like to ask to Amy.
One.
Amy, what role do you see health clubs taking to help physicians like Dr. Salas fill their patients' exercise prescriptions and feel comfortable referring them to a full-service health club?
Yeah, thanks for the question, Mike. I see health clubs taking a really active role in the exercise referral networks that I've researched and studied. I've found that there are a very small number of physicians who write the majority of the exercise prescriptions and referrals. So health clubs need to find those super prescribers, those champions, those physicians like Dr. Salas. And when they do find them, they need to do exactly what Mike Feidelberg talked about. They need to increase the physician's familiarity with the club's programs, services, infrastructure, equipment. They need to increase the physician's awareness of the clubs and the club professionals, their expertise and their capabilities in working with people with different conditions and diagnoses. And they need to increase the physician's understanding of whether patients are following through on exercise prescriptions and referrals. In my research, I found that about a third of physicians knew if their patients were following through on their prescriptions and referrals. They simply didn't know. And so health clubs can play a really important role in facilitating that long-term behavior change and helping to report back to physicians. So in a perfect world, in a better world, there's a much more systematized approach. Dr. Salas talked about the approach at Kaiser Permanente. Working with the Physical Activity Alliance, we're actually working to standardize measures around physical activity, vital signs, exercise vital signs, and make this a standard of care, as Dr. Wonders talked about, in the US healthcare system. We're not there yet, and in the meantime, health clubs need to play a more active role in direct communication and outreach to physicians.
Great. Thank you, Amy. Karen, I have a question for you next.
All right, I'm ready.
Yeah, can you speak a little bit to how cancer patients have really benefited when they get more active by using the Mapletree Exercise Oncology Program? I mentioned previously that you've done a study on over 11,000 people with cancer. So could you speak to that?
Sure. Yes, you're correct. Over the last 11 years, we have collected data and served more than 11,000 patients. We have more than 70 research publications that have shown basically that exercise is medicine. I mean, I think that's the most simple way to put it. We have found that our patients have improved treatment outcomes. They have a reduction in symptom severity. They have fewer dose delays and dose reductions when it comes to chemotherapy. They're able to return to work faster. They have reductions in healthcare costs. And, you know, I think that the main idea of what we do at Mapletree is everything we do is an individualized approach. So we are meeting the patient right where they are. And Dr. Salas said earlier that exercise and you know, going into a health club or just the idea of exercise can be very intimidating. And I have experienced that firsthand. You know, we have so many patients who have come to us and they've never exercised before. And that's the case of about 90% of the people that we serve. And I once had a patient tell me that she was more afraid to come to Mapletree and begin an exercise program than she was to start her chemotherapy regimen. And I think that really highlights this need to change that narrative and to break down the stereotypes of exercise and of what they're going to find when they walk into a fitness center, and to let the patients know that they're going to be supported, that we are going to meet them right where they are, that we're going to understand if they're having a bad day. At Mapletree, our motto is that something is always better than nothing. And so if all you can do is just a 5 or a 10-minute walk that day, let's do that, because that's better than laying on your couch or not getting out of bed that day. So we really try to meet the patient where they are and then help them to progress from there. I recently saw a statistic that said only about 2% of cancer patients are meeting the exercise recommendations. And so this highlights a huge market of patients that are out there that need these services and aren't currently participating in them. So I think that there's an opportunity here to serve many people and to change many lives. And I'm just very excited to be a part of this movement to help transform lives.
Well, you're certainly doing that, and appreciate those comments, Karen. Thank you so much.
Just to
Mike
dovetail on
Feilberg.
that, Mike, just to dovetail on that, could you imagine if you went to an oncologist and somehow he didn't know that doxorubicin was just an incredible drug for breast cancer, and he just didn't realize it? He'd never read the literature, so he didn't prescribe it. What would happen? Yet at the same time, you have similar data on exercise, and somehow they get away with saying, "Oh, I never read the literature." It just makes no sense that is allowed.
Mm-hmm.
Bob,
Absolutely.
I think Kaiser just released, and I think it was published in a JAMA letter on November 17th, the results of an 8-year study that they did on women with breast cancer that exercised. And I think that study showed that there was a 60% more mortality rate for the women that exercised versus the women that didn't. Could you maybe comment on that?
Yeah, you're exactly right. I mean, it's more powerful than most of the chemotherapies we use. It's just astounding that just sort of gets ignored, but anytime it's a drug, it's amplified.
So if we know those kind of results and we don't prescribe it, wouldn't that almost be considered malpractice?
Yeah, I would certainly think so.
I mean, that's a pretty powerful 8-year study report. It was just wonderful to read it.
Absolutely.
So
I think none of us are surprised.
Excuse me, go ahead, Bob.
None of us are surprised at that result.
Yeah. Mike, I want to ask you the next question. We're getting towards the end of the discussion, but I'd like you to share with the audience your experience with using exercise in treating other diseases.
Yeah, I mean, we've really had a wonderful wonderful experience, and it's really for all of the reasons that everyone has just mentioned as what the barriers are, because when you can overcome those barriers and you see people in your clubs that you would never normally have seen before without this kind of programming and without these kind of bridges, it's incredibly rewarding. And as we know, as Dr. Salas said earlier, we know the results can be outstanding, especially in people that have done very little or no exercise and then start a program. And the results that we've seen from people that have been participating, and then the ability to share those results with their physicians, and then see them come into the club in such a way that normally they never would have, and then be able to confidently participate, just increases their confidence, their self-esteem, as well as all of the numerous benefits we know physical activity provides, whether that's from a mental standpoint or physical standpoint. So we've had it's been a wonderful pursuit of ours, and I think has made us better, and has certainly increased our credibility within the community. I think it's something we're extremely proud of doing. And for all the reasons that everyone just mentioned, which are the challenges, and our industry has a lot of work to do to bridge that gap, to bridge that trust gap, to create standards. And when those standards can be established and they can be recognized by insurance companies and recognized by physicians, we will see this accelerate very, very quickly, because we know the results. We know what can happen. We just need insurance companies and in many respects, the medical community to catch up to what we're providing. But our industry has a responsibility to do certain things on our end, but they're certainly moving at a pace that I've never seen, in my career. So I'm very optimistic about what's coming next.
Well, you mentioned something, and certainly something we saw at our club as well. I think the impact that this has on your members and your staff and the community at large is pretty significant. It really makes a difference, and it elevates the culture of the organization.
Yeah.
So kudos on that. Maybe the final question to the audience. So this is a question I'd like to ask: if the merging of healthcare and fitness can become a new pathway to growth for both industries, and how?
This question is for the participants, the audience. Please feel free to use the chat to write your comments or your thoughts, and then we'll read those out, and the panelists will share their thoughts later.
Do we have one last slide?
Yeah, we do. So please write the answer in the text chat. Yes, there is no answer box in this case. Yeah, so Bob Esquire said that, yes, the challenge is staff training at the club level. And TJ Fortuna has asked, can we find a list of doctors who are prescribing fitness? How do we make that list? And Evie has responded by saying yes. So I've got 3 answers so far. While more are coming up, maybe we can ask the panelists to start, and then I can read out some more answers, to start sharing their thoughts, their final thoughts on this.
Let's start with Dr. Salas and just go down the list of panelists. How do you feel about this question?
Yeah, I just think it has to happen. And, I was certainly frustrated in the pandemic when very little consideration was given to health clubs, and in all places where people could be active, they were shut down with very little thought. And, we did a study early on in the pandemic, because we have this exercise vital sign at Kaiser Permanente, and we showed that our patients who were meeting the physical activity guidelines, doing regular exercise, were 2.5 times less likely to die should they get COVID. It's a powerful medicine for COVID. And in fact, a more recent study showed that those who were meeting exercise guidelines, their vaccine worked dramatically better. Yet at the same time, it took us almost a year to get the CDC to put on their website that physical inactivity was a major risk factor for severe COVID outcomes. So I think this has to happen. The fitness world has got to grow and meet this need that patients around the world have.
Great. Thank you, Bob. Mike Feidelberg, do you want to comment on that?
On the question up on the board right now, Mike?
Yes.
Yeah. I mean, I do think I think it's a major step for the health clubs. I don't think that there's a better set of infrastructure out there. When you listen to Dr. Salas talk about what we already know about the positive impact of exercise in chronic disease, and you think that these clubs have the ability to fill those prescriptions on a mass level, and the impact that could have on the overall health of our country is overwhelming. But I do think from a club's perspective, from a business perspective, in terms of growing membership and growing essentially a new level of participation from a community that we just don't see that much of, could have a major impact both on the fitness side and certainly on the medical side. But it's a tremendous, I mean, it is a tremendous opportunity with unlimited potential when harnessed correctly. There's no question.
Thank you, Mike. How about you, Karen, your comments?
Yeah, no, I agree with everything that everyone has said. And, you know, I've been specifically conducting research and working in the field of exercise oncology for 20 years now. And, you know, I do think that we have come a long way. I'll never forget the first hospital that I talked to, and this was back in 2014. You know, they kind of looked at me and said, well, anyone can take a walk, so why should we do this, or why should we offer this to the patients? And they didn't really see the value in it. So now, of course, you know, at Maple Tree alone, we have at least 55 clinical locations, and it's continuing to grow. And, you know, we're having these conversations now with fitness centers. So I do think that there has been a lot of positive momentum in the field over the last 20 years. And just the fact that we're able to have this conversation right now is a highlight of that. I do agree, though, that we still have a long way to go. You know, I know for us, it's getting this into standard of care and getting insurance to pay for this, getting physicians to see the value, getting the patients to actually participate in this, even on the days that they don't feel like it, even on the days where they're tired and they're sick and they're tired. And, you know, so I think that we still have a long way to go, but I am encouraged by the momentum that I've seen in this field over the last couple of years in particular.
Great input, Karen. How about you, Amy?
Yeah, I think Dr. Wonders and Mike Feidelberg have both referenced the fact that this is a huge untapped market. I think about 80% of the population is not consuming the programming and services that the health and fitness industry offers. But it's untapped for a reason. And the health and fitness industry has a responsibility, as Mike Feidelberg says, to become that credible, experienced, credentialed, trusted resource. Dr. Salas is looking for people to send his patients to, knowing people that he knows and trusts. But again, the healthcare industry also has a responsibility to realize this pathway to growth. And for every Dr. Salas, there's a physician who doesn't counsel patients on physical activity. I think a recent poll done by Morning Consult and Tivity Health found that 1 out of 2 older adults who saw their physician in the last 6 months did not receive any counseling on physical activity. How do we change that? And how do we put together the pathway so we have a clinician counseling, prescribing, referring to a trusted community-based resource in order to I really see the prescription and the referral as a means to an end, and that the end is to help everyone experience the healing power of physical activity, something that all of the panelists and everyone listening truly believes in. And how do we help the general population experience that?
Great.
Well said, Amy. I think at the beginning, it's almost, we have to trust this. It's like almost like you've got to build that and they will come. I think we got to start with building these programs and then to begin to advertise them and then make contacts that can get patients there. And the funding, you know, I'm just astounded on what we spend on things like hand sanitizer and disinfectants that we knew early on in the pandemic had no value. That's not how COVID was transmitted. But yet we continue to do those things that the evidence even shows they don't work. And yet we have an evidence-based therapy that somehow we're just not able to convince those that are in charge of the purse strings to purchase. It doesn't make sense to me.
Yeah, I have some great questions and comments. Let me at least get the questions done first. So we have EJ Whitney, who's asking, where do people with physical disabilities fall into this conversation?
Bob, you should answer that because you were very familiar with the
Yeah, I
program.
mean, you could take one look at the Claremont Club and the programs that we did for spinal cord patients. You know, I came to Mike after reading research on cycling and Parkinson's disease, convinced him to use the spin class and put Parkinson's patients in it. And we saw dramatic improvements in their Parkinson's, you know, probably 5 times the improvement that you'd see with levodopa, the standard medication for Parkinson's disease. We can go on, disease by disease, and disability by disability, how all of them get helped. And there are ways to do it. And we've just got to share those and build those programs and just insist that the medical community steps up and refers patients and that it gets paid for.
And Bob, comment on, you know, with the spinal cord program, we were in I think in the second year of an ARB approved medical research study with Kaiser on 55 of those spinal cord patients, and the results were phenomenal.
Yeah, absolutely. And yet there's nothing like that out there. It just sort of gets ignored and doesn't get paid for. But boy, if we had a spinal cord stimulator that helped even a fraction, it would be paid for. It just, you know, some of these things I just can't figure out. But I think it's all of us working together to just, we can't accept no for an answer because there's too many patients that need these therapies. They're life-saving therapies.
Absolutely.
Amen.
So there's another question, which is from TJ Fortuna. How can you get this into the schools? New and future doctors may be more likely to use exercise as a tool for patients. Are the studies being added to curriculum at med school? What does that process look like?
I can touch on, go ahead,
No,
Bob.
Oh, go ahead.
Well, I was just going to speak to some of the things that we have done in exercise oncology. And I work, in addition to running Mapletree, I also work as a professor of exercise science at a school in Dayton. And so I created an undergraduate class that can be inserted as a elective in any undergraduate exercise science or health related curriculum. We're running that class right now at 6 different universities. I haven't really done a ton to try to push it or promote it. But as you know, as this conversation continues, I'm going to try to do it a little bit more, because I do think that's one of the barriers that we could come across down the road after we get insurance and get this to be standard of care. I believe it's not a matter of if, but when. And I think one of the things we're really going to need at that point is a workforce. And I agree. I think we need to get this into the universities, into the medical schools, and start this conversation and getting people who are going to be working with the patients directly to understand the benefits and be able to speak to them.
I think, Karen, I think that's also going to be offered, or is being offered right now as an elective at the University of Laverne out here.
Okay, great. Yeah, we're in conversations with several other universities trying to get this to as many people as possible.
Yeah, Mike, and the only thing I would say too, the other player in all this too is obviously the insurance companies is a big player. So, you know, as the medical industry or the medical community and the fitness industry work more together, the need to get the health insurance industry more involved in understanding, because having the ability to have it paid for is going to make it much more easier for physicians to prescribe it and for clubs to bear, you know, the cost and create the kind of resources and education and infrastructure that they need to best serve this community. We need to have the insurance companies, you know, along with this for sure.
Absolutely, absolutely.
Yeah, in terms of medical schools, the best way to get it in a medical school curriculum is to have it be the standard of care. Then they've got to teach it. You know, if it's standardly done, they're going to have to come along and back that up why it is done.
Yeah.
And Karen, isn't exercise already an adjunctive standard of care for everyone in Australia that's going through cancer treatment?
Yes, that happened in 2018. So they definitely are leading the way in Australia, and hopefully America will soon follow suit. We do have the NAPBC guidelines, which were just recently published, that do address exercise in, I believe, 4 different areas. Those are optional right now to opt into those guidelines, but I believe they will take effect officially in 2024. So that's a good step in the right direction.
Yeah, and then
Okay.
New Zealand has what they call the green prescription, where you can make a referral and it's paid for. So there are some examples around the world where it's being done and it's working.
Great. Well, we're at the top of our hour. I do want to kind of end this by making a statement to everyone, if I can. I really firmly feel that the time is now for all of us to start using exercise as the powerful tool it is in treating and preventing chronic illness. As everyone said, there's a huge population out there. We need to be part of it. Costly drugs with serious side effects and costly procedures, I don't think we can accept that they are really the sole solution anymore. And I think our clubs have a responsibility to be a big player in this. We certainly can help people build abs and stronger buns, but we have to be about hearts and lungs as well. And I think Dr. Salas has said this in almost every presentation I've heard him give. Let us show you how to do this and how we can work together. So if there's any interest, I encourage you to reach out to me and at your convenience, and I'll look forward to hearing from all of you soon.
Thank you, everyone. We'll close this panel discussion now, but we promise to continue the conversation. Please look forward to more communication from us. We'll send you a recording of this link, and we look forward to continue to talk to you. Thank you.
Thank you all.
Thanks, everyone. Great job,
Thanks
Mike.
to pardon me?
Great job putting this together. Thanks.
Well, thank you, Bob. Thanks to all the panelists for participating and helping with this. You're all considered to be the best of the best in your fields, and I and everyone at Smart Health Club is very appreciative that you would participate. So thank you all very much.
Thanks,
Thanks.
Mike. Thanks, everyone. Great panel.
Being here.
Great
Yeah,
to meet
thanks,
you guys.
everybody.
Thank you so much.
Care.
Bye.
Bye.
Bye.